For individual selection of Gravistat reflex load device, fill in an order form. The form shall include the following data: age, sex, height, and weight. To define retractor size, take measure from sternum center at the level of fourth rib frontal to inguinal folds, then pass around shoulder joint and go to spine, located at the same horizontal plane with the first point. Specify obtaining data in the corresponding fields of the order form. Select corresponding size according to height and retractor. Then measure waist circumference. Enter data into the order form. Thigh circumference shall be measured at the level of lower thigh third, calf circumference in its widest point, and ankle circumference 2-3 cm above ankle. Foot shall be measured at its natural extension. Enter the obtained result into the form. Then define sizes for clavices mount. Totally, there are 12 dimensions. They consist of 3 left and right segments, ventral and dorsal surface, trunk area, segment A, thigh area, segment B, and a calf area, segment C. To take accurate measures, mark the waist with a belt. Dimension A is measured from the center of shoulder girdle to the belt center. Dimension B is measured from the belt center to the horizontal line 3-4 cm above patella. Dimension C is measured from the horizontal line 3-4 cm above patella to the defined line 2-3 cm above ankle. Specify obtaining data in the corresponding fields of the order form. Depending on patient's age, weight, dexterity, and exercise tolerance, compression load is calculated. Maximum load shall not exceed 20% of total patient's weight. Load shall be uniform for all segments. Depending on calculated load for a segment, clavices calculation schedule is selected. Load calculation schedules are intended for half of the kilogram, 1 kilogram, and 1.5 kg per segment. For sedentary segments A and C, non-elastic clavices are used, first category clavices. For highly mobile part of segment B, elastic clavices are used, second category clavices. All clavices have special fastenings, which are mounted stitches. With the help of these stitches, we're able to shorten clavices in a range of 5 cm. According to the table, based on experimental study of clavices physicals and measured lengths of segment A, B, and C, number of each clavice for each segment is defined. The table has 3 main columns. Each column corresponds to the compression load of each segment. Each main column is divided into 2 smaller columns, which are first and second category clavices. These columns have ranges of segment lengths, which clavices influences on. First numbers are the shortest clavice lengths. Second numbers are the longest clavice lengths, which clavice can be stretched to. First selection of first category clavice in column, which corresponds to calculated load on segment 1 kg, we have to choose an appropriate column of first category. Then we have to choose range, which is corresponding to segment lengths. For example, if segment length is 31.5 cm, then we have 2 corresponding ranges. One of them is 26.5 to 32.5 cm, which corresponds to the clavice number 20, and another corresponding range is 31.5 to 37.5, which corresponds to the clavice number 25. This means that we can use clavice number 20 if we fasten one mounting stitch in a standard option and another stitch must be doubled in 1 cm. Or we can use clavice number 25, but both mounting stitches must be doubled in. We can use that clavice which is more comfortable to work with or which is available. Using known numbers of clavices, assemble consecutively a load chain, connected elements by means of fasteners. Mark the middle of the chain, which is fixed to the center of shoulder girdle, with a special two-color element to define the front, ventral, and the back dorsal parts of the load chain. The chain is assembled only once during the patient's rehabilitation. For comfortable marking of right and left sides, chains are immediately fixed to shoulder pieces and stored on a hanger. When all basic mounting elements are selected according to patient measures and load chains are assembled, the patient can put the device on. First, basic mounting elements are put on. The first element to put on is the retractor, then the belt. For patient's comfort, basic mounting elements for lower extremities are put on when seated. Fasten the retractor to the belt. First, put on integrated bandage for thigh and calf. Leg shall be half bent in the knee. Bandages shall be located as follows. Joint shall be located in a knee hollow and fastener on the lateral knee surface, with front area closing. Then assemble toe and sole element. Insert a supinator in it. If the patient uses foot control, the toe and sole element shall be preferably replaced with his or her foot control. Fastener of the fixed element shall be closed outwards. Calf bandage is the only device element which has left and right version. It is fastened to the toe and sole element. While fixing on a foot, fastener of the calf bandage shall be on the side of the element and have front area closing. When all basic mounting elements are fixed, load chains can be fastened. Shoulder pieces and color marking of middle fastenings allow easy defining of right and left sides, as well as their front and rear parts. Shoulder pieces are fixed to retractor straps. Once this is done, fasten simultaneously clavices of segment A to the belt. Then, simultaneously stretching, fasten clavices of segment B to the upper part of a thigh calf bandage, and finally fasten clavices of segment C to ankle bandage. The toe and sole element is additionally fixed with the first category clavices, crosswise from toe to heel. Adjust clavices tension to correct foot position, varus or valgus. There is a precast device for exercises with controlled axial load. On doctor's order, individual lateral chains, rotary corrective clavices, and enforcement of pathologic posture can be used in addition to axial load.